In equine veterinary medicine, few events are as catastrophic as a thoracic aortic rupture. The aorta, under immense hydrostatic pressure, completely fails, tearing transversely near a developmental remnant called the ligamentum arteriosum. This chart tracks the incidence of these ruptures across different breeds. While the baseline for most warm bloods is nearly flat, the rate for the Friesian horse forms a towering spike. The rupture frequently creates an aortopulmonary fistulation, a massive internal bypass between the aorta and the pulmonary artery. Because the blood is shunted rather than lost into the chest cavity, affected horses can occasionally survive for months with severely compromised hemodynamics. The Friesian registry maintains a strictly closed studbook. This intense genetic bottleneck has preserved the breed's distinct phenotype, but it has also concentrated specific pathological traits. To manage the health of this population, veterinary science requires precise mechanics. We need to know if the entire cardiovascular system is inherently fragile, or if this failure is isolated to a single structural point. For years, the prevailing clinical hypothesis among veterinarians was that Friesians suffered from a generalized connective tissue defect. The assumption drew a direct parallel to Marfan syndrome in humans, a condition defined by widespread elastin degradation that leaves the entire aortic wall dangerously weak. In a systemic connective tissue disorder, the microscopic network of elastin and collagen breaks down uniformly, weakening the entire biological structural lattice. However, recent investigations into the physical properties of Friesian tissue have begun to challenge the validity of this Marfan model hypothesis. Treating Friesians as if their entire vascular system is deteriorating leads to misdirected clinical management. More importantly, it obscures the actual mechanics of why their aortas fail. Researchers at Ghent and Utrecht universities designed a study to physically test the mechanical integrity of the Friesian aorta against unaffected warm blood horses. They harvested tissue strips from 3 specific locations, adjacent to the ligamentum arteriosum, labeled LA, the mid-thoracic region, T1, and the distal thoracic region, T2. These samples were then subjected to uniaxial tensile testing. Metal clamps gripped the tissue, incrementally extending it from a zero-stress state until it completely ruptured. This line graph shows a stress-strain curve from the testing apparatus, mapping true strain against the engineering stress required to break it. Because the aorta is a nonlinear material, researchers calculated tangent stiffness moduli, marked E10, E20, and E30, measuring elasticity at specific deformation increments. Mapping the exact tangent moduli removes observational bias. It yields objective mathematical data regarding the physical strength of the Friesian aortic wall. This chart compares maximum engineering stress across aortic locations. The T2 cluster shows the distal aorta handles higher stress universally. At LA and T1, affected Friesian red bars and unaffected warm blood blue bars are identical, indicating no statistical difference in tensile strength. The data proves the Friesian aorta possesses zero systemic biomechanical weakness compared to other warm bloods. The tissue is exactly as strong. Because the cardiovascular tissue maintains normal tensile strength under extreme loads, a generalized connective tissue disorder cannot be the cause of these ruptures. To verify the mechanical testing, researchers quantified the exact dry weight percentages of collagen and elastin within the aortic strips. This chart displays collagen concentrations. Collagen dictates high-pressure resistance, and as expected, it naturally increases in the distal T2 region for all horses, aligning perfectly with the stiffness data we just examined. This chart tracks elastin, the critical biomarker for diagnosing Marfan-like pathologies. Elastin distribution remains uniform across all test groups. The red bars representing affected Friesians show completely normal elastin percentages, directly contradicting the hallmark degradation required for cystic medial necrosis. Normal biomechanical strength combined with normal elastin levels confirms the physiological reality. The Marfan hypothesis is fundamentally incorrect for the Friesian breed. Instead of a systemic failure, the aortic ruptures stem from a strictly localized hereditary defect. Specifically, it is medial fibrosis occurring immediately adjacent to the ligamentum arteriosum scar. This pattern of highly targeted structural failure appears elsewhere in the breed. Idiopathic megaesophagus is another pathological trait frequently diagnosed in Friesians. The disease presents as a concentrated overgrowth of smooth muscle fibers, an isolated muscular hypertrophy strictly at the caudal end of the esophagus. Morphologically similar to Alport syndrome, this localized mutation creates a singular failure point, while the rest of the esophageal musculature continues to function perfectly. A distinct physiological rule emerges for the breed. Friesian genetic bottlenecks manifest as these highly localized, hyperspecific structural anomalies. Knowing these vulnerabilities exist at specific biological nodes requires a calculated shift in how these animals are conditioned and tested for the studbook. The original central examination subjected young stallions to immense physiological strain, forcing intensive cardiovascular output on consecutive days of training. In response to clinical data, the KFPS adjusted their 70-day stallion test. They eliminated intensive consecutive training days to protect these vulnerable nodes from cumulative mechanical overload. Replacing consecutive cantering with mandatory active rest creates critical micro-recoveries. The rest periods allow plasma lactate concentrations to drop and heart rates to stabilize fully before the next exertion. Managing the Friesian requires treating it as a highly capable athlete. By implementing meticulous, data-driven recovery protocols, we can prevent catastrophic mechanical failures at their specific genetic constraints.